Good day. This is Dr. John Dombrowski, Washington Pain Center. So say you've done your trial of spinal stimulation and you end up liking it. So what's the next step? Great question. I think the next step for you as a patient is to get the implant. Now again, there are two individuals that do this. Anesthesiologists traditionally do this, as well as neurosurgeons. Neurosurgeons normally do a lot of spine surgery, anesthesiologists don't. Again, neurosurgeons will tend to put in a laminectomy lead. That is essentially where a lead, it's sort of flat like a tennis racket. It's flat instead of round like the pieces of spaghetti that I showed you before. The surgeon will do surgery to create a laminectomy, so cut this bone away, and then slip this paddle in underneath where it needs to be. That's the reason why that neurosurgeon needs to work with the anesthesiologist or physical medicine rehabilitation doctor to make sure exactly where's the target. So they need to work in concert with each other. And then the lead, if you had a laminectomy lead, gets laid down on top of the dura, and then the leads come out, and the battery, which is here, then gets tucked underneath the skin. And this battery is rechargeable. Basically, all batteries now are rechargeable, which is great for patient care. And how they do it, you basically take a charging device, put it into the wall, 120 or 110 volt, put it over the device. It changes the electrical energy into a radio wave. The radio signal then gets picked up by the battery that changes back into electrical energy. It's amazing. Again, everything's done subcutaneously. The leads are brought subcutaneously or underneath the skin, and you go home. Normally my patients, I'm sure most patients, go home that same day. Again, you might need to spend the night, and that's always up to your physician and their surgeon what's going to be best for you as a patient. Now, just because you have this in place doesn't mean the care stops. You'll most likely need post-op follow-up in a week or two, making sure the wound is okay. You'll most likely need continuing programming to make sure the device is working well for you. Again, it is just a start on a very long journey to getting you back to your life that you want. Thanks for watching.